From Boston University and BU Alumni Relations, welcome to Proud to BU Around the World. I'm your host, Jeff Murphy, and this season we're taking the podcast on the road to meet some of our most interesting and accomplished alumni navigating life and careers in cities across the globe. Today my guest is Elaine Hsieh, founder of EHChocolatier. Elaine graduated from BU's 6-year medical program in 1990. And following her residency, she established a women's health practice in Arlington, Massachusetts. After nearly a decade of being called doctor, Elaine left her career in medicine to pursue her passion for food. In 2010, she opened her own chocolate shop, which has since been celebrated as best in Boston among a long list of other accolades. While Elaine is one of more than 86,000 alumni in Greater Boston, her unique entrepreneurial story certainly stands out, and she reflects on why she believes the Hub was the right place to launch her business. Elaine, thank you so much for joining us on the Proud to BU podcast.
Oh, thank you for having me.
Of course. So you are a graduate from the BU Joint College of Arts and Sciences and School of Medicine program. You're a physician who now runs her own chocolate shop. What happened? And we'll get there. But
oh, it's so much more fun. What happened? Well, I did actually graduate. I was a practicing physician, and after a few years, I felt like I was done, and I wanted to do something different.
All right, well, we'll dive in on that.
Okay.
But I was reading your website, and you had a interesting anecdote about things all starting with an Easy Bake Oven.
Oh, my Easy Bake Oven.
So did you know growing up, you fell in love with cooking as a kid?
I did. So I would say the Easy Bake Oven was my gateway to food. And from there, all sorts of things would happen in the afternoon after school. When I was in elementary school and middle school, actually, I'm kind of surprised that my mom and dad actually let me do it because they weren't home. I was a latchkey kid. So, it would be puddings and parfaits and soups and things like that. And then, in high school you take home ec, which I don't think they offer that anymore. Yeah. But I have clear memories of setting jelly-filled muffins on fire in class and all sorts of other things. On
purpose, or it was an accident?
No, it was definitely not like a flambe situation. It turned out to be that way, but that wasn't the goal. But yeah, I really liked making food. My mom actually is an excellent cook, and she, despite being an immigrant from China, was actually really good at making classic New York cheesecake. So when I was in high school, I would actually take it to school and sell slices of it at lunch.
Just for a little extra pocket cash?
It was funny. I don't even know what it was that I was doing. I just felt like my mom's cheesecake was amazing, and I couldn't believe that no one else had ever had it. It never occurred to me to give it away for free because I felt like she worked at making it, so she should be paid for it. And my parents just kind of went along. Again, I don't know what my parents were thinking now that I think back.
So did you grow up in this area? Where are you from originally?
I grew up on Long Island.
Okay.
Yeah.
And then so how did you end up at BU? You've got this love of cooking and food, but obviously you had other intentions when you came to BU. You started immediately in the 6-year medical program, right?
I did. So I come from a very traditional Chinese family. Mm-hmm. So I'm the youngest of 4. And I would say, although my mom is an amazing cook, and that's what we grew up with, cooking was not considered something that you would seek out as an occupation. It wasn't even a discussion. Our choices were limited to professionals, jobs. So basically medicine, law, engineering. My dad's a mechanical engineer. And so my oldest sister is a hand surgeon. My second oldest sister is a lawyer, although she's retired now. My brother is a professor in emergency medicine, and he's a paramedic. So that just kind of was the path that we were expected to take. And I think we're a very efficient family. My oldest sister did the 6-year medical program through Albany, so the RPI Albany program. So when I was looking at programs, it just was very natural that I would only be looking at 6-year programs. We were in the New England area. I looked at several of them. BU was the one that was the most appealing to me because my second oldest sister, Shing, is still living here, but was living in Cambridgeport at the time and working. And she and I are very close, so it made sense for me to come to BU.
Sure.
Yeah.
So you get to campus, and let's talk about the experience you had here. I'm curious to know, sort of outside of classes, what your experience was like. Where were you living? What do you remember about campus at that time? Where were you hanging out? Where were you eating? We were talking earlier about the Chinese place around the corner.
Yeah. So it was great because I parked in the garage of Warren Towers, and that was the only time I lived on the dorms because I moved. By my second year, I'd moved out to an apartment. Mm-hmm. So I lived in Warren Towers. That was crowded. And let's see. So at the time, I don't know if they do it now, but you are kind of your hallmates are a combination of the accelerated 6-year medical program, girls, as well as pre-med. At least on my floor, I was at 6A, mm-hmm. and other than going to classes and studying a lot, the things I remembered at least about being an undergrad. We talked about Burger King, which is now no longer there, but that was there were a lot of fire alarms, it seemed, especially around finals, which I could never understand that whole concept. People were saying, well, like if you pull the smoke alarm, maybe you won't have to take your final tomorrow. And I always thought, that's crazy. So we would and then of course you couldn't take the elevator, so you'd have to like traipse all the way down. I felt terrible for the people up on the upper floors. So then you go to Burger King. But like Mel's Deli used to be there. That's not there anymore. Mm-hmm. That Four Brothers. Oh my God, that was like the introduction to the Philadelphia cheesesteak bomb. It was like, I don't know, I must have gained like 30 pounds my first year here. It was amazing. What other things would we do? Oh, our class, we played intramural volleyball, mm-hmm. Over at Sargent. I don't know if they still do that over there.
Yeah, there's still a gym there, but the intramurals happen there's a newer facility called the Fitness and Recreation Center.
Yeah, so that was a lot of fun. That was probably the only physical activity any of us got. And, and at Marsh Chapel, we would actually have crazy, like, football games on Marsh Chapel in the winter, of all things, now that I think about it. So, we sort of fit in a few things here and there. Yeah. But honestly, we were only on campus for the first 2 years.
Right.
And then after that, we were gone.
Well, and everything I've ever heard about the 6-year accelerated program is just how incredibly academically intensive it is. So it's great to hear that you at least had some fond memories of fire alarms that I'm sure that you just mentioned something that thousands of BU alumni have experienced in their time here. So between the quote-unquote undergrad experience you had and the med school experience you had over on the medical campus, are there specific classes that you took or professors that you had that really stand out in your memory as having sort of an impact on you?
I mean, I definitely have memories of the undergrad classes. I wouldn't say they were my fondest memories. It was much more enjoyable once we got to the clinical portion of medical school, at least for me. And that, I don't know what it is now, but it was the third and fourth year of medical schools when you would actually start seeing patients. And that, for me, was kind of where I really got lit in terms of what I really enjoyed doing. Yeah.
So you talked a little bit about the family role in your education, and that you felt like there were certain accepted professions and maybe directions that you wouldn't normally go in. I can't help but wonder if while you were here on campus, maybe did you have in the back of your mind that this path wasn't the one that you truly wanted to be on, or were you at the time really in love with medicine and the idea of becoming a physician?
I don't think at any point I would say that I had a love for wanting to be a physician. I think out of the choices I was offered from my family, that seemed the one that suited me the most. I liked helping people, and I liked interacting with people. Like, I remember that in high school. I think I didn't feel very strong in the humanities, and I think I definitely didn't want to go down the engineering route. So I think by default, medicine became my choice. Mm-hmm. And I think when you're in the 6-year program, you're kind of on a route, like it's a path. And it's, I think it's hard to like stray off of it. because in some ways your classes are very specific. So if you stray off, it's a challenge to know where you would go from there with the classes that you've taken.
Right.
So I would say the time where I actually felt like perhaps it was not the right path for me was probably when I entered medical school, probably out of my first year. I think I had always felt like, the courses that I had to take as an undergraduate were like courses I just had to take and sort of get through. And when I went to medical school, I think my expectation was that I was going to really love my medical school classes. For the most part, my first year there, I really struggled. I didn't really enjoy the classes that much, and from an academic standpoint, I felt like I really had to work hard, and I wasn't excelling, which I think for someone who came from a place where you felt like you were sort of academically quite competent, it was sort of an eye opener and a bit frustrating.
So when you started medical school, you were like 20, 21? You
20.
2 years as an undergrad and then go to med school? Okay.
Yeah, I was 20.
So that's a lot for somebody at 20 to deal with. How do you feel like you managed that sort of, it sounds like an imbalance, right? That you, on the one hand, you had these expectations and things weren't going quite as you had intended. So do you remember back then, like how you sort of managed that? Because obviously you continued on and you finished.
Yeah, so I would say that there was a time during my first year of medical school where I had spoken to my oldest sister, who I think I mentioned did this 6-year program at RPI, and said, I'm not really sure if this is a good idea for me. I don't know if it's a great fit, and I'm about to embark on a few years of this, and I just don't know. And I think she felt very strongly that I should stick with it, that things can be challenging, but overall, I started the program, that I would finish the program and it would be okay. So I think if nothing else, in terms of how I managed it, I think that if nothing else, I'm very persistent, and have, I'm very good at working through challenging times, even if the carrot's not right there.
Yeah.
Yeah.
So you finish med school and then you start your residency, right? And what were you doing? What sort of, is that a rotational? Forgive me, I don't know the ins and outs of med school,
it was totally fine. I mean, the one thing I did, just to sort of back up, I would say my third and fourth year at BU was exceptional. And you rotate through Boston City Hospital.
What was Boston City Hospital? Yeah.
Sad. And University Hospital.
Yeah.
And so you have clinical rotations of, I think, 6 weeks to 3 months of different specialties. And I have to say that was the saving grace for me. I felt like, okay, I found my people, and I feel now like this is a good choice for me. And so when I graduated, I felt very clear that I wanted to stay at Boston City. And internal medicine, that's what I did my residency in. The attendings there were phenomenal. The house staff was exceptional, and the mission of the hospital really spoke to me. So I did my residency there, and that's a 3-year period of time.
Hey BU, a quick break here to tell you about another great resource if you're looking for ways to advance your career. BU hosts dozens of free professional development webinars each year, and in the coming weeks we'll feature topics like the Thought Leader Formula and Right Career Right Now. Presentations are delivered by your fellow alumni who are career experts or industry insiders eager to share insights, strategies, and best practices with the BU community. To register for an upcoming webinar, visit our website at bu.edu/alumni/webinars. And on the very same page, you can find our comprehensive on-demand library of previous presentations. And then what happens? I think you end up working in kind of specializing in women's health? Am I right? Okay.
So I finished. And so even though it was a great experience, I knew I didn't want to stay. And so I created a women's health program out of Mount Auburn Hospital called Arlington Women's Health. And so there was internal medicine and midwifery, OBGYN, rheumatology. There were a couple of other specialties there, and I was there for a couple of years, and then I moved on to a medical director position at the Spence Center for Women's Health.
You were there for just about 9 months.
I was.
So is that when you had sort of this epiphany moment of, okay, this is not what I want to do? I don't mean to focus on what some people might see as sort of negative aspects of your career, but I think one of the reasons we have this podcast is because it's so interesting how people make decisions about their careers.
Yeah.
And we recently saw some statistics that, the chances of a BU grad who's finished their undergrad degree 10 years later, there's a 50% chance they might not be working in the field that they studied.
Yeah.
And so these stories are fascinating, and I think it's all about making decisions and having the courage to do it. Mm-hmm. So how did that all shake out for you? And I realize it could be probably another hour of us talking about
exactly.
it, but how do you sort of articulate that story?
Well, I think, I think once I went into practice, and became an attending versus being a resident. So the level, or in my feeling, I felt like it was sort of a burden of responsibility. It was quite heavy, and hats off to all of my friends and colleagues and anybody else who practices medicine, because I admire them. I really felt like, for me, it was a bit soul crushing.
Yeah.
I had a lot of people who were worried. I had a percentage of people who were very ill, and I had a hard time kind of managing the hypervigilance part of not wanting to miss anything, but then with sort of like somewhat of the tedium of everyday type of work. And this was many years ago. I can't even speak to what it's like having to have electronic medical records to have to deal with at this point, or insurances. I'm sure it's even more tedious now than it was when I was practicing medicine. So when I went out to practice medicine, I think I began to realize that the thoughts I had as more of a freshman or second year in medical school were actually still there. And really the thing that kind of made it better was the people that I was with. Mm-hmm. But then once I kind of left that situation and I was kind of on my own for the most part, my doubts returned. And so for me, I tried doing the more classic switch, which is I tried to do less and less clinical work and tried to do more administrative executive work. And that was partly when I moved over to the Spence Center. Mm-hmm. I was able to decrease my clinical by half and do more administrative by half. And, it was kind of at that moment that the Spence Center also kind of went down the tubes. And so they ended up being purchased by partners, mm-hmm. or at least absorbed by partners. And my role really was to help with that kind of merge with partners, after which I felt like I was kind of done. Mm-hmm. So
was there like a morning where you woke up and said, screw this, I'm going to cooking school?
Well, I would say the crying when I went to work every morning for a few months was probably a telltale sign.
Yep.
Yeah.
So it was a long time.
It was a very long time. I mean, I think there's no benefit in kind of going back and saying what if.
Yeah.
Because, I had a lot of life experiences. I made great friends, and really the work that we did at Boston City, I felt like was meaningful work. So I definitely don't have any regrets of that time that I spent there. Yeah. But in terms of, so basically what I did was I left clinical medicine, although I did do a little moonlighting for a few months, and then moved more towards consulting work in healthcare. At the same time, during this time when I was practicing medicine, the way I would relieve my stress was to cook. Yeah. And so I thought, why don't I take some cooking classes? And ultimately, I ended up going to the Cambridge School of Culinary Arts, mm-hmm. and thinking that I would just go because it was something to do. I would really sort of enjoyed, but it was interesting. I enjoyed savory cooking. I was really not a baker. I wasn't a dessert person at all. I mean, I like eating desserts, but I wasn't someone who kind of that's the direction I would go in. And it just turned out that at that program there was just an exceptional pastry professor there who really just encouraged me to. She's like, you really have a hand for it, and I think you really have the disposition and the patience for it. I really do think that that's where you should go. So that's where I went.
And then you went to chocolate school.
Well, so that's
that's what it's called. Maybe was it more of a dessert?
No,
baking?
So basically, EHChocolatier is it's based in British Columbia. It is interestingly an online program. It was the first time I'd ever taken an online course. Yeah, so basically what happened was I did my culinary program. I graduated with a professional chef's degree in '99. I started a private dessert business while I did healthcare consulting. I had my twins in 2002, decided to stop doing the dessert business and just focused on my kids as well as on my healthcare consulting. And then, and I would do some food-related things over the years. And then basically it was like 2009, 2010 when I kind of cut the cord. So in 2010, basically, I stopped doing anything in medicine.
Right, okay.
Yeah.
And that's roughly when you launched your business. So that's what I'm hoping to hear more about is the process of deciding you're going to do this as your main gig. And I know you have a partner in crime.
I do, Catherine Sweeney.
Yeah.
She's amazing.
So you met working on some side dessert projects, is that right?
Yeah.
Okay.
Yeah. Catherine basically came into my life just as I was finishing culinary school. And we have a mutual friend who wanted us sort of like, we had never met each other. She asked me to make her wedding cake. And I said, okay, even though they don't teach you that in culinary school. And then after I said okay, like a couple months later, she's like, okay, and then my good friend, Catherine Sweeney, is going to help you. And I said, that's great. So she's made wedding cakes, right? She's a baker. And she's like, no. She's like, doesn't make wedding cakes. And I thought, what? And so ultimately we ended up, I love this. So basically she's like, okay, so first you're going to make the cake. Okay, then I'm going to give you someone else who also doesn't know how to make wedding cakes. Oh, and then I would like you to make this like multi-tiered cake with cascading edible seashells coming off of it, like this picture from Cape Cod Wedding. Oh, and then did I mention that we were getting married on Martha's Vineyard in the summer? And we were like, she kept like adding these things on. And at that point, Catherine and I sort of had met and chatted, and she was like, what's happening? I was like, I don't know. So ultimately, we ended up making this cake. It went well, obviously, and we became very good friends over that. And so, from basically 1999 to 2010, Catherine was kind of like my food person in crime. She's actually was over at Harvard University in their admissions and financial aid department. And so I would drag her. I'd be like, okay, I promised to do this. Can you come help me? And she'd be like, sure. And I'd be like, okay, it's Christmas time. Let's make treats. And she'd be like, sure. So she had always been very up for doing things with me, food related. And so she actually had an opportunity to take early retirement in 2009, 2010. And at that point, for me, the healthcare consulting was really just something that I did, nothing that I really loved. It wasn't overly stressful, but it really was sort of like a soul suck. And at that point, my kids were sort of old enough that I felt like it was a good opportunity to just stop doing anything. I think in the back of my mind, I always thought, well, maybe I'll go back to practicing medicine. And then at that point, I think I even had to renew I had to take the boards again, and I thought, okay, I'm not going to take the boards again, so I'm never practicing medicine again. So that actually was the point where I was like, okay, I'm done.
So I can only assume that having a passion for desserts, for food of any kind, is maybe 20% of starting a food-based business in the Boston area. What can you tell us about people who have that passion, about what they might not know about starting a business? And if you could tell us about those first few years of opening a brick and mortar and all of those lessons that you've learned in doing that.
Well, I think when we started in 2010, I feel like at that point, Boston had become a place that was much more open to artisanal type foods. I think probably a few years before then, I don't think our business would have been as successful. I think people were their palates or their interests in food just wasn't as it is today. I mean, right now Boston is, I mean, it's huge, in terms of food. Everything's food. It might be because I'm a little skewed because I'm in the business, but it just seems like food is a big part of Boston now. And it wasn't so much. Definitely wasn't when I was in school here. Definitely wasn't in the 90s as much. But like by the time we started our business in 2010, it felt like it was a great time to actually introduce different, chocolate than what people were used to here. And, in terms of starting the business, you're right. I think the chocolate or whatever the food item is that people are producing it's an important part of their business, because if it's, it has to be good, or else people won't buy it. But it is, in terms of the business itself, it is actually a surprisingly small percentage of the business.
Mm-hmm. So what were the things you didn't know then that you know now about owning your own business, being an entrepreneur?
It's a lot of hard work. I think that people have, when they think to start a food business, there is this romance of making something that you love, like, oh, it's my passion and this is great and I want to share my passion with all these people and they're going to love it. And, there is this like, oh, if I build it, they'll come. And I'd say maybe they'll come, but it's surprising how much you have to actually market your product and how new is kind of the thing. Mm-hmm. That I feel like has been the hardest part for us. Like, I feel like we make a really good product. Right. And the thing that we always have to do is we always have to think of new products, which, when you're excited about something and you want to create something new, it's really easy. But if you have to create because you have to catch someone's attention, it's much harder. And then you're kind of feeling like the piece that you're working on just isn't really kind of working for you. So it's twice as hard. And so there's that part where, I mean, at least for the business that we do, we have a set kind of like perennial collection, but then every holiday we have our holiday collection, but then every year for that holiday we have to then create something new. So it's challenging to continue with a consistently excellent product if your menu continues to broaden like that. And so, of course, when you talk to business people, they're like, well, you would look at your numbers and then you would see what's not selling so well and then you would take those away and then blah, blah, blah. And I have to say, I mean, I don't have a business background, but I do actually have some common sense. And so we do run our numbers. And the first several years, Catherine and I would sit there, I'd have my sheet and I'd be like, okay, the chocolate chews, just not really selling. And she would just look at me. She's like, yeah? I was like, yep. So I think we're going to have to just let that one go. And she's like, what? I'd be like, yeah, I know. She's like, how could they not like the chocolate chew? And I was like, I don't know. They're just not interested. And she's like, I think we should wait another year. Like, okay, we'll wait another year. The second year would go around, and I'd be like, okay, the chocolate chew, still kind of at the bottom of the list. And she's like, no, they just need a little more time. So I would say, from a business standpoint, perhaps we don't always function as efficiently as we should, but we're kind of, it's like your children in some ways when you make these things. You're like, people always ask us, like, what's your favorite one? And we're like, that's like asking which is my favorite kid. Yeah. Like, we love them all, and it's hard to pick them out. So for me, that's like sort of some of the harder parts. And then there's just the regular stuff that no one really sees. Like, I do the dishes. I take the garbage out. I have to make sure that if the mailman doesn't come pick up our post. I can't tell you how many times Catherine and I literally, on our last day of shipping for the holidays, Christmas time, you will find us schlepping all these boxes down to South Station. If anybody wants to know, South Station stays open 24 hours a day, and they're super nice down there. And even at like midnight, they're super nice down there. So we kind of do everything when you're a small business like us.
So I'm curious, and I can only imagine that you knew you were going to get this question. Are there parallels that you can draw between your med school experience, being a physician, and the skills and the traits you needed to be successful there, and what the parallels you make with either the chocolate world or being an entrepreneur. And I'll set you up. I mean, you talked so much about during your med school experience about persistence and how much you had to rely on that as a skill that you had. Are there other things that you might say are not unique?
Yeah, I mean, I think partly has to do with aside from persistence, I think, especially at Boston City Hospital, since it's not well funded, you had to do a lot of the work as the house staff. So you had to be creative. You also had to work around. You have to do a lot of workarounds. I don't know how it is now, but like no transportation. Okay, I'm the transport. Oh, there's like a puddle in like the tunnel. Like, okay, I guess I better go a little faster. So So there's, I think there's that part of it when I was training that translates very easily to how we function as a small food business. We don't, we fund ourselves, and so, like a lot of the stuff is things that we have to do. And Catherine and I are not business people, and we're not specially trained in different things. So a lot of it was sort of training ourselves on our own, figuring out workarounds when software is not working. I'm, believe it or not, tech support, which basically means I remind Catherine that she should turn everything off and then wait 20 seconds and then turn everything back on. Almost works like 95% of the time. So I think there's that part. There's the science part. Obviously I think chocolate, candy work, anything in pastry or baking, it's all very heavily science-based.
Sure.
So that part is quite appealing because, if you understand the science, you can, for the most part, troubleshoot many of the things that you run into. I'm going to think what else is there. There's the people aspect, of like taking care of patients, taking care of your customer. It's a little different, but there are some similarities to that. I think people, for the most part, just want to feel like you're interested in them, that you care, like you care about the experience, whether you're taking care of them as a physician or if you are taking care of them in terms of like talking to them about the chocolates or selling them some chocolates or giving them something to sample. So I think there's those overlaps between the two.
So your business is EHChocolatier, and you're literally an award-winning chocolate shop. You've got, I know for 2019 you won Best of Boston Chocolate Shops. That's not the first time you've won that award. I don't believe you've gotten awards from Best Chocolate in the U.S. from Food and Wine, other awards from Yankee Magazine, the New York Times. What do those accolades mean to you, and are there others that you're particularly proud of?
Well, it's always when people recognize us for our work. I mean, partly, you're not really doing it for the accolades, but it is validating to have other people recognize you for that.
Now I want to know, we didn't really talk about how your family reacted to you making this pivot away from medicine and becoming a business person. How is things with your family? How did they feel about the change at the time, and how do they feel now?
Well, I think the change at the time, my mother was, So I think my parents were both unhappy about the change. I think my mother, when I applied to the culinary school, I think the question you had to answer was what inspired you to apply to culinary school. And so I talked a lot about my mom because honestly, growing up, the memories that I have of the things that were the most heartwarming were things related to my mother's cooking. The amount of time she spent preparing, holidays, my siblings coming home. Just my mom's an amazing Chinese cook as well as just an amazing general cook. So she was my focus on my essay, and But I think, sort of to back up a little bit, I had stopped practicing medicine for about 6 months before I told my parents that I had stopped practicing medicine. I just couldn't get there yet. And then finally at 6 months, I told them, and I think my mom dropped the phone, actually. I think she just didn't even, there was a bit of wailing. And then subsequently hearing things like I didn't know what else to do, like I wasn't trained for anything else. What would I do with my life? I could do nothing else but be a doctor, which I have to say was not very reassuring.
Did you know you were going to get that kind of reaction from your mom, though?
Yes, there was a reason why I waited 6 months. I felt like there was never a time that I felt like my parents would be okay with this, you know, because for them, we're in a much better place now. Mm-hmm. But back then, it was a real loss of faith for them, I think in terms of just what would they tell their family and relatives. And I think also, they put in a lot of work. They were immigrants. My dad was an engineer. He worked really hard. And they committed everything to their kids in terms of their education and financing it. And even though we all took loans, it was a real sacrifice on their part, but something that they did. Like, they did it gladly. So I think for them it was like, what? Now, it's been a few years. They're in a much better place. And my mom actually says, oh, she gets that from my side of the family. She's like, oh, my family was very successful in business and food. My dad was the best tofu, seller in his hometown. So I would say now they seem fine with it.
I was hoping that would be the answer you had for me. Yeah. Well, I'm ashamed I haven't been to visit yet. Where can people find, in addition to your store, are your items available elsewhere, or? Yeah,
we have a couple of specialty food stores that we're in, like Formaggio and Bacos, Bricks. Yeah, those are some of the ones that carry us.
And your shop is it Somerville or Cambridge?
No, it wasn't Somerville. We're so excited. We moved into this place in January, 145 Huron Avenue in Cambridge.
Is that Huron Village in Cambridge?
It's called technically Observatory Hill.
Oh, yeah, okay.
Yeah.
Yep. So not too far out of Harvard Square?
No, not at all.
Okay.
Yeah. Yeah.
Well, congratulations on the new location.
Thank you.
The holidays are going to be here very, very soon. Do you do online orders? If we've got alumni who are interested in learning more, where should they check out?
Well, that was actually most of our business in the beginning is online. So we ship anywhere in the United States, including Hawaii and Alaska. And we ship at any time of the year. So we can do anything for the holidays or for other times of the year.
Awesome. Thank you for being here and sharing your story. It was really interesting to talk to you.
Oh, well, thank you for having me.
Thanks again to Elaine for joining us on the podcast. I really had a great time talking with her. And we were especially grateful for the chance to taste test some of her delicious creations. The holidays are coming up, and even if you can't make it over to her Cambridge shop, be sure to check out her website, EHChocolatier.com, to place an order. On behalf of everyone on the BU Alumni Relations team, thanks so much for listening to Proud to Be You. If you enjoyed this episode, please be sure to subscribe, rate, and review our podcast wherever you find your episodes. I'm Jeff Murphy, and no matter where your path takes you, be proud to be you. The Proud to Be You podcast is produced by Boston University Alumni Relations. Our theme is from Jump and APM Music. To learn more about Proud to Be You, visit bu.edu/alumni/podcast.